Welcome to the second episode of our interview with Mr. Jorgen Souness, who is the CEO at St Vincent de Paul. In the first episode, we spoke about his leadership skills and why he decided to join the nursing profession. In this second part of our interview, we shall be delving deeper into Mr. Souness' leadership skills and the daily challenges that he faces in his current and in his daily activities at St Vincent de Paul.
Malta's future starts with a conversation. Idea Talks.
Mr. Souness, thank you very much for your time once again. My first question in the second episode would be, in your work as CEO, what gives you hope?
Seeing those patients transitioning from the acute hospital to the intermediate care and going back to the community, I believe it's everyone's satisfaction to see a person, a resident, integrating back to the society. Apart of that, giving the utmost of our healthcare professionals that they can give to our patients for their last years, the end of their life at St Vincent de Paul, that's the best satisfaction even from the feedback of the relatives.
So when you have people getting into St Vincent de Paul, because there is this perception that when you go to St Vincent de Paul as a resident, that's your last phase of life. It's not the case. So we have people coming in, they receive their care, they get their rehabilitation, and they go back home, they go back to their community.
Exactly. There is part residential where people come and spend the rest of their life at the residential area. There is part, we call it the hospital license part, where they come and transition from the acute to the community. And then there is the outpatients, where we are tackling around 300 patients daily, and they have outpatients appointments at the day clinic at St Vincent de Paul to be seen by a specialist.
In such a profession, I was always curious about this. Do you get to appreciate life more because you are all the time seeing people who are in need of help, of medical care? The elderly who are usually frail, younger patients who are patients, they are there to get medical care. Do you get to appreciate life more?
Sometimes
than other people in other professions do?
Exactly. Sometimes you take life for granted, like hectic routine in life, day to day, demands, family. But yes, working within this field makes you appreciate life more because you see the medical conditions that you quite often, oversee, they don't even pass through your mind, you don't even think about them. But when you see persons, patients, we call them patients, working 60 years of age, 65 years of age, they are going into the retirement period, and then all of a sudden they pass away. Some thoughts come to your mind. You say, listen, I've been working for all these years. That patient has been working for all these years, but now there's no time for him, to enjoy the last remaining years of life. Nowadays, we are calling 60 years of age geriatric. I agree, and I don't agree with it. 60 years of age, when you reach 60 years of age, even the international strategy, they refer to 60 years of age as geriatric patient.
You're still young at 60 years of age.
Yes, that's it. 60 years. I believe what's in your heart, what's in your mind. 60 years of age, you're still young. Nowadays, people are still even extending their working routine till 70 years of age. But thinking about it, you need to enjoy life, not just focus on work. You need to dedicate at least, not if preferably every day, but at least part of your everyday or part of your weekly days task. You need to assign it for personal to take care of your good self and even your family, which is the most important.
If you weren't in healthcare, then what would it be?
Good question. I never dreamt of being out of healthcare because since I was a small boy, I used to see my mother working as a nurse.
So your mother was
a nurse, yes, a nurse by profession. And it always, inspired me. Even I used to see movies, doctors, nurses. I think you are born by that instinct. But keeping nursing aside, I really like operations. Operations means strategic operations, working into big companies, private companies that have a lot of operation strategies going on. But I find it hard to believe that I will, opt out of healthcare someday.
You're still very young to talk about legacies, but let's for a minute consider that, what would you want your legacy to be once you finish this role of CEO at St Vincent de Paul?
My legacy in this current place of work, I would be that all my decisions, all my projects done so far, we brought the CT scan, MRI soon to come, all these projects, these millions which we invested in this hospital, are all patient-centered care. They are all revolve around the patient needs rather than our personal needs. And to have a client visiting a hospital where he or she will say, we just brought feedback from customer care about it, that St Vincent de Paul is turning into a one-stop shop for the elderly. So a patient comes here, we have outpatients clinic, we have dental, we have the physio department. That's my dream, that eventually St Vincent de Paul is turning into a fully-fledged hospital, which every person dreams of, that if in case of any medical need arise, this place will cater for that need.
So anything which is elderly related in healthcare, you're saying that that will be the place to go.
Exactly.
And that will ease a lot of pressure from health centers around Malta and from Mother Day itself, no?
Yes, exactly. That means that we are decentralizing services from the acute hospital rather than focusing all these services into the acute hospital, which is almost in the center of Malta. We are decentralizing services to St Vincent de Paul, which, as you know, the demographic of Malta, the population is focused on the south area. So if we cater for just the south and the central district, central areas for St Vincent de Paul, that means more than 60% of geriatric demand on the acute hospital. And it's quite a lot if you have to, translate it into numbers.
In tough moments, in moments when you need to take tough decisions, do you lead more with your head or with your heart?
I believe you need to think with both. Why? We're dealing with patients here, not with robots, or tangible things. You need to think with your heart, because you need to think in the patient position. Like, if you are the patient, then you need to go to that. What is the best ideal way forward? But in the meantime, you need to think with your head as well, because you need to think strategically. I try to avoid lean management for obvious reasons, because I don't believe that every penny that is being saved is good for the patient in these circumstances. Like I said, healthcare is totally different than other fields of practice. You need to invest in healthcare to have the best output. And obviously nowadays we are looking into technology, which obviously is not cheap, So by thinking by your head, you mean that you are going to progress forward. By thinking with your heart, you mean that you are putting yourself in the shoes of the patient and thinking from his perspective.
Artificial intelligence is advancing at a very rapid pace. And it is often said that there will come a time, which some predict might be soon, whereby artificial intelligence, robots for instance, would replace nurses, would replace carers in elderly homes, in elderly hospitals. What do you think of this? Do you see it happening anytime soon?
I don't see that happening, to be honest. Robots will never replace the human touch. Part of my studies, like I explained, I'm focused on these things. The robots will never replace the bedside care a nurse or a carer can provide to the patient. They can assist by providing another pair of eyes for the nurse or for the patient or for the doctor, but will never replace the human touch. Like I said, the feeling a patient's experience when a nurse or a carer talks to him in his own language, preferably, it will never be replaced by robots. We're working on AI technology investments, projects in AI, but to monitor more the patients, to have another pair of eyes, like I said, to have more real-time data being inserted into the computer so that to monitor the patient in a timely manner, but never to replace healthcare professionals.
We're soon concluding this interview, but is there something when you talk to the residents themselves, because at St Vincent de Paul, and rightly so, you refer to residents rather than patients, which they tell you, we wish that managers understand this better when they're dealing with us, not directly, of course, but in their managerial decisions on how wards are administered, etc. Is there something which you identify and you say, yes, this is what residents wish that managers understood better?
Yes, that feedback, unfortunately, was caught several times by not just St Vincent de Paul, but even the acute hospital throughout the past years. What we did is we invested in a multidisciplinary team that a doctor lies with nurses, with allied workers like physio, OTs, psychologists nowadays, and even other specialties in that field, and discuss the best way forward for the patient. For example, if a patient is experiencing, for example, loneliness, he or she don't need a doctor to attend to that. He needs someone to speak to, like a psychologist or a nurse that can, interact with them. And by engaging all these stakeholders together, by creating and doing multidisciplinary meetings almost on a daily basis, we managed to overcome that situation lately.
In your career so far, has there been a moment which really touched you on a humane level, which you said, this is really the moment that changed my perspective maybe on how I see things, or the way that I act, or the way that I design?
I believe there were multiple times when I experienced these situations, but if I recall well, once, after just a couple of months, I started working as a nurse. I had a patient, I forgot the age, but it was middle-aged, 60, 50-something age, 50 years plus, where unfortunately he was suffering from a chronic illness, leukemia, and the daughter was abroad on work. She used to work abroad. And he was admitted in my respective ward where I used to work, and the patient was really not in a good condition. In fact, he passed away, unfortunately, after a couple of hours. The daughter didn't manage to see her father because she was basically workaholic. Okay. She always preferred work, rather than her family. She managed to arrive. She caught a flight, an urgent. She managed to arrive when the patient was still in the mortuary there. She came to our ward to thank us for the care given to her father. And she explained to her how in the past years she managed to completely forget about her family, and that tends to work abroad, work in Malta. And she lost basically 15 years of her life engagement with her father. So, you need to appreciate life, like I said, and not after your family member or anyone else passes away, but during the lifetime.
Absolutely. Mr. Souness, thank you very much for your time. It has been fascinating for me because you give us a perspective into an area which interests us all, after all. I mean, if it's not our parents now, it's us in the near future. So thank you again for your time. That brings us to an end of this episode with Mr. Jorgen Souness, the CEO at St Vincent de Paul. Till next time, thank you for your time.